Good morning. I'm Sue Henderson. I'm on the City Council and I'm also a member of Age Friendly South Portland. Today we'd like to talk to you about some things that are being done for COVID in our city. And I'd like Shawn and Clovis to introduce themselves to you and talk about what they're doing in our city.
Good morning. I'm Shawn St Germain. I'm one of the deputy local health officers here in the city of South Portland. We were hired in August as part of the effort to mitigate and combat COVID-19 here in the city. And among our tasks is to share education and information with the community and to do what we can to make sure that people stay safe here in South Portland.
Good morning, everybody. My name is Clovis Lemba. I'm a deputy local health officer in the city of South Portland, working with my team, as Shawn has said, working for the safety of our population and outreach, also with our minority population living into the city of South Portland.
So what are some of the ways that you would like to talk about that seniors and everyone can stay safe during this pandemic and well?
Some of the things that we talk about are just maintaining diligence around personal hygiene, keeping your hands washed, wearing a mask when you're around other people. But aside from that, things that we can do just to stay healthy in general also help mitigate some of the risk, and things that I'm talking about are maintaining a healthy lifestyle, eating a healthy diet, getting good exercise, seeing your doctor when you need to see your doctor, staying social. There's a real cost to social isolation as well.
So now we're seeing advertisements for the routine flu shot. What do you both think about that?
Well, I think it's as important as it ever has been. We know that COVID-19 is not the same as influenza, but influenza can be very dangerous as it always has been. And of course, we recommend getting the flu shot, but also speaking with your physician, with your medical provider, to make sure that that's something that's safe for you. We know that COVID-19 can happen in conjunction with influenza, and then it can make influenza worse and vice versa.
I want to just go back a little bit to the masks wearing and the social distancing, because I was thinking of getting the flu shot. Certainly you can get a flu shot in the supermarkets, in the pharmacies. And I know that it's hard to wear a mask. I mean, I wear glasses and I put a mask on and my glasses immediately fog up. And then I feel like I can't hear. I have a mask on my mouth, but yeah. So wearing a mask is not easy.
It's
always,
challenging. This is an adjustment that we're all having to become accustomed to. I wear glasses too, and yeah, I get the same fogging in my glasses, and it causes some irritation. It's uncomfortable. But this is our new normal, and this is something that we need to do to make sure that we stay safe, and we recognize that it's not always convenient, but it's really in our best interest. It's in everybody's best interest to maintain that.
Yes, it is hard. It is hard wearing mask every day, and you have glasses. But as you say, Shawn, it is a new normal life. It's a new normal life. So what we're supposed to do, that while I said about psychological support. So we have to be very, very aware and very prudent about the message we are sharing to our population. New normal life doesn't mean that's easy life. So it's ask us some acceptance. We are like submitting our life to some kind of discipline. So this kind of new normal life, it's not easy. That's why we are working with a holistic sense of support.
Right. And let's go back to the hand washing and the hand sanitizers too. What do you think about the hand washing versus the use of hand sanitizers?
So what we've learned is that hand washing with soap and water for at least 20 seconds frequently is the most effective way to keep yourself safe. Hand sanitizer is a nice alternative. It's not as effective, but it'll work. if you don't have soap and water available, but we certainly do recommend frequent hand washing for at least 20 seconds, warm water, soap.
Yes, and in fact also, scientifically, hand washing with soap, just for 20 seconds is the best way to clean everything, dirt and some various microbes from our surface or our hands. But it's gonna be very easy to do hand sanitizer. Hand sanitizer is not cleaning exactly like washing our hands. The first thing is washing your hands, washing your hands, washing your hands.
What about if people, is it safe for people to go to their doctor for routine care? What do you think about that?
Absolutely. I think that doctors' offices are seeing patients now in the office. They do have some options to do things by telephone, to do remote care, certainly some remote screening. And so I think the best bet is to at least reach out to your provider, to your doctor, and run things by them first. They may want to see you in the office, but it's absolutely safe. They're taking precautions, checking temperatures, asking questions, and so on before you come into the office. So absolutely, if you're feeling ill, please see your doctor.
Good. So how do you feel, Clovis, that the minority population is doing with the message, your messages? Are you being well received?
Yes, this is a very, very important fact. And Shawn can just help me because we have been with our community, minority community, almost immigrants, African immigrants, Vietnamese, Spanish, all our minority population are impacted about COVID-19. But the problem is really serious, and we have to take a great action about that. That's why we are focusing our work to help those minority. Detailing that the fact is very important. I'm gonna show you that all minority has problem with COVID-19 interpretations. For African, in the majority, we have people who have COVID-19 asymptomatic and people who have COVID-19 but hiding this disease because of they are ashamed to share to others that they are sick. That is the fact they have in mind, that they are ashamed to show others that they have COVID-19. For that, what they do, they just go to take some Tylenol over-the-counter medicines, some Tylenols, some ibuprofens, and stuff like that. That's gonna lead on hiding the disease instead of being healed or cured. So what happened after that? The contagiosity of the disease will not stop. It's gonna be spreading. So that the fact we are working with them and trying to help them to show up, dry up those kind of situations instead of taking those auto medication at home and being ashamed.
Yeah, I think that's a common thing with all people to some degree, to be afraid of, to find out if to deny the symptoms because they're scared. I think that's pretty common. And I think to have hope that getting treatment early is going to get the best results and going to be the best for everybody. But yeah, I think with not just this disease, I think what Clovis is talking about, people have done with diabetes and heart disease and cancer. And if I go, I'm going to die. And that's why they don't go. And they're going to have a better chance to live if you go and get seen. Yeah. What are some of the things you've been experiencing, Shawn?
Well, it's to add on to what Clovis was mentioning, we're doing a lot of outreach into these communities, and we found that it's been very effective. We've done some Zoom meetings with leaders from some of the immigrant communities, and that sort of thing is important, I think, in overcoming some of the fear around seeking treatment. And that's definitely something that we're up against. As Clovis mentioned, there's a real concern around that, and so it's important that we get that information out accurately and in a timely way. So we're finding that in some of the other communities and elderly communities and housing projects and so on, some of the public housing buildings here in South Portland, what we're experiencing is folks are staying in a lot. And so there's that real social aspect or lack of socialization that people are experiencing. There's a real risk to that. Clovis had mentioned the psychological aspect of that, and that's true. But folks are often unable to get to their doctor for whatever reason. Maybe they don't have other resources in the area, family or friends and so on, that can help them get there. We're doing what we can to make sure that they get this messaging. Not everybody has access to cable TV, for instance, or internet, for instance. And so we try to hand out literature when we can. There are many, many different ways that we can try to reach people. And so that's been our job here for the last several weeks, is trying to figure out the best ways to do that.
Do you know anything about is buying the hand sanitizer pretty much in the stores? Is it all good in the local stores, do you think?
I think so. I think the key is to buy it with and I can't recall the exact percentage, but a high percentage of an alcohol-based hand sanitizer. And they're all over the place now. The stores are full of large bins of the containers and so on, and you should be able to find it just about anywhere.
Yeah, so I bought some, and I would have thought, I hope this is I hope this is good.
Yeah, I think so, and I would have to look that up, Sue, to tell you what the exact concentration needs to be, but I think most of the ones that are being offered are probably meeting that standard. Good.
What are you recommending now about, I know Shawn and I talked a little bit about Clorox and disinfectant surfaces and things. What are you telling people about that now? Yeah,
I don't, again, I don't, obviously we don't want to use straight bleach to clean anything. That's probably not the safest option, but you know, a safe mixture of that, or there are other commercially prepared pre-mixed sprays and so on. And we just recommend frequent cleaning, particularly in surfaces that you use a lot. So countertops, doorknobs, keyboards, telephones, that sort of thing. Just keep them clean as best you can, particularly if there are more than one people, if there's more than one person using that.
And particularly in buildings or multiple people, every time you touch a door handle, multiple people have touched it. So you're going to do your hand sanitizer and not touch your face, because.
And that's a habit that a lot of us are in, isn't it? We frequently touch our own faces and don't even realize it. So it's another habit to try to, and wearing a mask can help with that. You're less likely to touch your face, I think, with a mask in place.
You mentioned socialization. So people can socialize, right? I mean, you can sit outside. You don't, if you're 6 feet apart, you don't necessarily need to have a mask on if you're 6 feet apart, right?
So that's probably the safest place to do it. You know, get some fresh air, which is good for you. It's good for your mind. It's good for your body. And spend some time outside with friends and family. It's perfectly safe, and we highly recommend doing that.
Yes, and we recommend that people continue this real life and their routine, but they have to add again some safety guidelines. So they have to socialize to continue normal life, or it's going to be very, very huge for people to support, to be facing this COVID-19 disease. And
to have some people can socialize inside wearing masks and doing some social distancing.
Perfect.
And then also having some, it's been recommended, I think, to have people that you trust are being safe themselves. So have a circle, or what do you call it, a bubble. Have people in your bubble.
Good point.
Develop a bubble. So I was going to ask about how you guys are keeping safe. How are paramedics protecting themselves?
We'll try to practice what we preach. You know, it's very important that we do the things that we're telling everybody else to do. So we try to wear masks when we're around other people. We keep our hands clean constantly. As far as emergency services go, there's a lot of equipment to keep clean between calls. It's important that you disinfect every piece of equipment that's had contact with anyone between calls so that there's no cross-contamination. And then, so if you were to call 911 and you were considered to be at risk for COVID, in other words, you had a fever or other signs and symptoms, The paramedic taking care of you would likely be dressed up in a gown with a face mask, maybe a head covering, goggles, that sort of thing, gloves, of course. And that's for their protection and for your protection. And it looks a little bit severe, I think, if you're not used to seeing that sort of thing, but it's important, and that's what's in place now to keep everyone safe.
Seems that I had heard something about, certainly you're going to call 911 for non-COVID things,
Of course.
regular emergencies, but I think somebody said if you're calling and you know you have some respiratory symptoms, it would be good to say that so that people could come prepared.
Yes, and so one of the things dispatchers are doing now when you call 911 and you have a dispatcher on the other end of the phone is they'll ask you a series of questions. They do this anyway as a matter of routine, but some of the questions are going to be geared toward COVID. So they may ask you if you've traveled recently. They may ask if you have a fever, if you have a cough, sneeze, any symptoms of COVID. And that will help guide some of the response in terms of how folks are dressed when they come to see you. So if you don't have any of those things, you may get someone wearing gloves and a mask, and not necessarily a gown and goggles, but you may, depending on the level of perceived risk. So it's perfectly safe to call 911 as you normally would, whether you have signs and symptoms of COVID or something completely unrelated. The response will be the same.
Is there anything else that you want to add?
Yeah.
So, go ahead, Claudius.
Okay, thank you. So what I just need to emphasize is about individual, community, and all of us.
Mm-hmm.
We have COVID-19. We have had before flu, but we never get COVID-19. So how come if instead of COVID-19, we have a other disease gonna come? So we have to be prepared to face all those odds into our life. So we have to be very prepared that something strange never came before, but can come for the next 2 years or month. So that's why we have to agree that we have had flu, but now we have COVID-19, and we have to deal with COVID-19 as a fighter, not alone, but public battle.
We recognize that this isn't easy. It's not easy for any of us, but we are all in this together. We're trying to keep ourselves and each other safe. We know that there are people that have been a little bit hesitant or resistant to wearing a mask. What we ask people just to be cognizant of is, as COVID said, it's not simply about keeping yourself healthy, but keeping your community healthy as well, and try to keep that in mind.
Thank you. Thank you very much. Thank you for doing all your good work too. That's awesome.
You're welcome. Thank you very much.